Afternoon, everyone, and welcome to the Booker T. Washington Awards. My name is Marvin Figueroa. I am the Director of the Office of Intergovernmental and External Affairs at the Department of Health and Human Services. I serve as Secretary Becerra, the U.S. Secretary of Health and Human Services Principal Advisor in strengthening intergovernmental relationship with states, local, territorial, and tribal governments, as well as private sector, nonprofit, faith-based, and other external partners to advance shared priorities. And it is such an honor to be here with you all today and be with such a group of individuals committed to eliminating racial inequity. The Biden administration, as you know, is focused on equity and eliminating racial disparities. We know that a person's zip code is a strong driver of health. So we will continue to prioritize getting the necessary resources to those areas and communities that have been hardest hit and are the highest risk, so that we can change the course of the pandemic, deliver immediate relief for hard-hit families and small businesses, and build a bridge towards economic recovery. I'm excited today because we are here for the Booker T. Washington Awards. Awards that recognizes an individual or organization that has made an outstanding contribution to the promotion of wellness in emerging populations. Booker T. Washington started the National Negro Health Week in 1915 to promote wellness in Black Americans. From 1921 to 1953, National Negro Health Week was a program supported by the Public Health Service. I partnered with Congress and the White House 45 years later, and NMQF started National Minority Health Forum Month in 1998 as a successor. Today, I have the distinct honor of introducing NMQF's president and CEO, Dr. Gary Puckrein. Gary Puckrein is PhD, is president and chief executive officer of the National Minority Quality Forum. And the forum addresses the critical need for strengthening national and local efforts to use evidence-based, data-driven initiatives to guide programs to eliminate the disproportionate burden of premature death and preventive illness for racial and ethnic minorities and other populations. Dr. Puckrein also serves as executive director of the Alliance of Minority Medical Association, which was formed on the basis of evidence-based data that highlight significant disparities in healthcare treatment plans and outcomes among many underserved populations within the nation, as well as his commitment to equity and his dedication to our community. But in the interest of time, I will turn the floor over to Dr. Gary Puckrein. Mr. Puckrein.
Marvin, thank you so much for those kind words. You know, I really appreciated the history because sometimes we get caught in the moment and we think that the issue related to health disparities is some newfound thing. Booker T. Washington took it on in 1914. Actually, W.E.B. Du Bois wrote about it in 1898. And the struggle has continued for over a century. But I think something's different now. I think we're at a point where we can really finally, as a nation, come to grips with disparities. I think if you look back and we're honest with ourselves about the 20th century, what we know is that it was a period in which segregation and inequalities were acceptable, both in terms of law and practice. And we're trying to overcome that legacy system. We at the National Minority Quality Forum, this is our 19th summit, and we're pleased to have some old friends and lots of new friends join us. When we started the summit, we spent a lot of time talking about disparities, essentially enumerating disparities in cancer and diabetes and asthma, and sickle cell. I mean, across therapeutic areas, these disparities existed. And it got to the point where we became frustrated just by listing numbers, and we wanted to do something really tangible to bring about change. And I'm pleased to say that the National Minority Quality Forum is partnering with organizations all over the country to take this moment in hand and begin to define a healthcare system that provides quality care for every individual that comes through the door. And where we've landed is really around patient risk. Our sense is that every patient who comes into the American healthcare system expects that system to lower their risk for hospitalizations, lower their risk for emergency room visits, lower their risk for disabilities, lower their risk for mortality, while improving the quality of their life. And it doesn't matter who that individual is, by race, by creed, by sexual orientation, by political beliefs, none of it matters. The fundamental principle of our healthcare system has to be about mitigating patient risk. And we think if we can get our healthcare system to get its brain around that, disparities will be addressed. Every individual will go into the healthcare system believing that the system is going to improve their outcomes. Sadly to say, we look at what happened with COVID and we know that's not working. We know that we still ration care, we still have privileges in the system, we still do not have a system that is patient-centric. And so we at the National Minority Quality Forum, we're eager to part with any and all who want to get their arms around managing patient risk. It's a numbers game. You can actually run it by numbers and see where those inequalities exist and really do something fundamental about it. We think that that's the challenge of the 21st century, to get our brains around managing patient risk. And I think the work of W.E.B. Du Bois, Booker T. Washington, who we honor at this luncheon, and the work that he did with National Negro Health Week, and all of the work that others have done will really bring about change. And then finally, I would say, I'm truly excited by the next generation that's coming aboard. I see them in our 40 Under 40 program. They are spectacular. They are just spectacular. And anybody who thinks that there are not qualified minorities out there to take leadership position are fundamentally fooling themselves. I've seen them firsthand. We've partnered with them. They are spectacular. And you're going to see some more of them during this event. We've recognized over the last couple of years, over 260 of these 40 under 40, and Marvin is one of our 40 under 40, and he is spectacular. He is doing really great things, and we're really proud of all of his achievements. None of this work, however, can get done without the help of sponsors, our partners, to make the work that we do go, to help us as we join hands in community. Because the really deep secret about healthcare is that it's a collaboration. People don't understand that, but healthcare at the end of the day is a very deep collaboration that requires all of our partners to work together towards one goal, which is to mitigate patient risk. So I want to take a moment to thank our sponsors for their support for the summit and for the support that they've given us over this year and indeed in prior years. So our silver sponsorships are Amgen and Dexcom. Our gold sponsors are AstraZeneca, Genentech, GlaxoSmithKline, Merck, Novo Nordisk, and Sanofi. Our platinum sponsors are Baxter, Genentech, Gilead, Global Blood Therapeutics, Philips, Pharma, and Regeneron. And our 40 under 40 sponsor is Amazon. And we're so thankful for all of the support that we've received. And you should understand that they're working hand in hand with us in community to affect change. So I want to thank you very much for your support. And now I'll turn it back to Marvin.
Thank you, Dr. Puckrein, and thank you for your leadership. We know that this work is hyperlocal, and we thank you for everything you do to make sure that we never lose focus on that. Next, I'm happy to introduce Dr. Susan Bailey. She's an allergist, immunologist. She was elected president of the American Medical Association on June 2020. Previously, she served as the president-elect of the AMA for 1 year, speaker of the AMA House of Delegates for 4 years, and as vice speaker for 4 years as well. Dr. Bailey, who has been active in the AMA since medical school when she served as a chair of the AMA Medical Student Section and has held numerous leadership positions with the AMA. Her long history of service in helping guide organized medicine extends to the local and the state levels as well. Dr. Bailey is an allergist in private practice and has been with Worth Allergy and Asthma Associates for over 30 years. She completed her residency in general pediatrics and a fellowship in allergy and immunology at the Mayo Graduate School of Medicine in Rochester, Minnesota, and is a board certified in allergy, immunology, and pediatric, and has been awarded the title of Distinguished Fellow of the American College of Allergy, Asthma, and Immunology. Dr. Susan Bailey, the stage is yours.
Thank you so much. Thanks for that wonderful introduction. It's a great opportunity to be a part of this wonderful health summit and an honor to be here and represent the AMA in this discussion. Now, as many of you know, the AMA 2 years ago created the Center for Health Equity to focus and provide strategic direction for our work addressing inequities in healthcare. The center, as we call it, fulfilled the vision of the AMA's Board of Trustees, which had sought to better understand how systemic inequities, racism, and determinants of health influence an individual's and a community's chances for a healthy life. There are many wonderful organizations, including many represented here at this summit, already working in this space to eliminate inequities for Black, Latino, and Indigenous communities, among other groups. But we felt very strongly then, as we do now, that there's an important role for the AMA to play in health equity, lending our voice and influence to call out racism and discrimination in healthcare and to change the system for the better. 2 years later, the AMA Center for Health Equity began laying the foundation for how we will approach our work today and over the long term. By embedding equity in practice, process, action, advocacy, innovation, and outcomes. By building alliances and sharing power via meaningful engagement. By ensuring equitable opportunities and conditions in health innovation for historically marginalized people and communities. By pushing upstream, including into medical education, to adequately address determinants of health. And by creating pathways for truth, reconciliation, and healing, recognizing how AMA's own actions and policies since our founding have contributed to the unequal health system that exists today. So that's the big picture overview of what the AMA seeks to achieve and the basic framework for how we and others can accomplish it. But let me give you a few examples of how this work is already taking shape as we continue to fight one of the most urgent threats to public health and to marginalized communities that we have ever experienced. Over the past year, the AMA, through our Center for Health Equity, created a number of free tools and resources for physicians to better understand how inequities were driving dramatically different health outcomes for Black, Latino, and Indigenous communities during COVID-19. We launched the COVID-19 Health Equity Resource Center on our website and developed a report focusing on Latinx inequities within COVID-19. We called on the federal government to collect and release COVID-19 data on race and ethnicity to provide better insights into protecting at-risk communities. We launched the Prioritizing Equity video series that features physicians and health equity experts from a variety of organizations that has become essential viewing to understand the pandemic through an equity lens. All 26 episodes of our Prioritizing Equity series are still available for free on our website, ama-assn.org. We hosted a series of seminars with leaders from the CDC and the FDA to give physicians a front row seat on the development of safe and effective COVID-19 vaccines, the review process, boosting vaccine confidence in all communities, and insights into the federal effort to scale and accelerate vaccine distribution. We, through our support behind passage of the Federal Mothers and Offspring Mortality and Morbidity Awareness Act, better known as the MAMA Act, to extend postpartum health coverage from 60 days to a year in hopes of reducing alarming rates of pregnancy-related deaths, particularly among Black women in the U.S. We made a 2-year, $2 million investment in Chicago-based collaborative working to address inequities and influence determinants of health on the city's west side. Our financial support is helping provide much needed capital to transform Chicago neighborhoods through low interest loans that can improve access to housing, address food deserts, create or expand small businesses, and provide greater economic opportunities. We have launched a new medical justice and advocacy fellowship program through an exciting new partnership with the Morehouse School of Medicine's Satcher Leadership Institute. AMA launched a national public awareness campaign called Release the Pressure in partnership with Essence to target the high rates of heart disease among Black women. The campaign provides resources to identify and track your blood pressure numbers, as well as help in developing a wellness plan to manage your heart health. AMA continues to work on increasing diversity in medicine through our AMA Foundation scholarships for students who are underrepresented in the medicine, through our Minority Affairs Section scholarships, our Doctors Back to School program, our Accelerating Change in Medical Education and Reimagining Residency initiatives, and our advocacy on behalf of international medical graduates and our work through the courts to uphold DACA. AMA is also proudly sponsoring 100 virtual screenings of the documentary Black Men in White Coats this year, raising the awareness about the lack of Black men in our physician ranks and hoping to inspire a new generation to enter the field of medicine. And we recently launched the Health Equity Resource Center on the AMA Ed Hub, our online training and learning platform, which offers education modules to better understand how determinants of health excuse me, influence and explore the role of physicians in identifying and addressing structural racism in medicine. The AMA believes, as I do, that to be a leader in medicine, to fulfill our mission of promoting the art and science of medicine and the betterment of public health, requires us as an organization and as a profession to lead on the issue of health equity. It requires us to use our considerable resources and influence to help dismantle structural racism, eliminate inequities, and to work with purpose toward a more equitable future in medicine and healthcare. Now, as I mentioned in my brief remarks this morning, our vision is a system where all people have access to the care they need, where tools and resources are equitable, where we work to identify and eliminate common barriers to care, where we root out discrimination and racism in all forms, and where all people in all communities have the power, information, and opportunities to achieve their best health. This is an ambitious goal, but I know we are all fighting here for the same cause, and that the work we do together will help improve lives today and for generations to come. Thank you once again, and congratulations to this year's award winners.
Thanks so much, Dr. Bailey. It's great to always have you and hear from you and get the support of the American Medical Association. I'm here today to just honor our outstanding Booker T. Washington outstanding nonprofit, and which is Healthcare Ready. Healthcare Ready, if you're not familiar with them, they leverages unique relationships with government, nonprofit, and medical supply chains to build and enhance the resilience of communities before, during, and after a disaster. They've been great to me and my community, is that I came here to DC because of Hurricane Katrina. And I first became familiar with Healthcare Ready personally because of their executive director, Nicolette Louissaint. She was in our inaugural class of our 40 under 40 winners. And I've had a chance to work with her even more when we did community health clinics around the nation. She's always working when, with this or that, her and the organization have always been working. There's always unfortunately, there's always like some big event happening, and they're always at the forefront to make things better. Just this year alone, working in the COVID space, they were able to give out 15.5 million surgical masks, gloves, and gear, 1.2 million K95 masks, 10,000 N95 masks, 24,000 gallons of water, 25,000 face shields, and 77,000 packs of batteries. Now, that's just a small thing they did partially this year. I invite you all to go out and look at healthcareready.org, check out their annual report, and you will just see the great amount of work they've done in 2020, but they've done in previous years as well. And I think that's in no small part to them following living their mission, but also because of the hard work of their executive director, Nicolette Louissaint. So I want to turn it over and congratulate Nicolette Louissaint and the team on this award. It's virtual, so we'll be mailing it to the organization. And without further ado, Nicolette, or Dr. Louissaint, sorry.
Thank you so much, Brandon, and thank you to the National Minority Equality Forum for this award. I am thrilled to accept the award on behalf of our staff. Our team is delighted. As you can imagine, it's been a very intensive year and a half for us. We actually started our activation to COVID in November of 2019, recognizing the impact that the potential pandemic would have on the supply chain and what that would mean for patient health across the globe, but especially in the United States. So thank you all. As Brandon mentioned, always an honor to be back with NMQF after being a part of that inaugural class of the 40 under 40, and thrilled to see that program continue to grow and the amazing leaders that you all have recognized over the years. Just taking one quick second to talk about Healthcare Ready. As Gary mentioned at the beginning of his remarks, the importance of partnerships and how partnerships play out in making sure that we can deliver healthcare and quality healthcare is so pivotal, especially in this time. And so continuing to make sure that we are doing our work of leveraging those partnerships and existing in that space between public and private to really identify for us those communities and patients that are at the intersection of social vulnerability and medical fragility, recognizing that especially in a disaster, their outcomes will fare worse if we are not taking those partnerships and turning those into actionable solutions that can be used to address their needs before, during, and after disasters. So again, just thank you so much for the award. Thank you for your partnership. We look forward to continuing to be able to work with you as we are collectively working towards making sure that we can ensure that those patients are not being forgotten and left out in a crisis. Gary, I think you're on mute.
Thank you. I'm sorry. I want to take this moment now to introduce you to our corporate awardee, Regeneron. For those of you who don't know Regeneron, let me talk to you about COVID therapeutics. In the middle of the pandemic, we developed therapeutics for COVID. They are being underutilized, which is really one of the great frustrations at the National Minority Equality Forum. As we look upon the number of minorities who have gone to the hospital, who lost their lives, who have suffered long-term effects from COVID when there were therapeutics available. Regeneron was one of the companies that led the charge. But Regeneron does much more than therapeutics for COVID. And I want to make sure you understand that I think that's a big deal, right? That we ought to be managing that virus a lot better than we are. But they're also doing work in asthma. We're partnered with them in ophthalmology. We're partnering with them in skin cancer. This is a company that is really at the cutting edge of bringing new therapies to communities like ours that desperately need them. But they're also great corporate citizens. They understand the issues related to inequalities in our healthcare system and devoted themselves to bring about change. So it's with a great honor that I asked Maya Bermingham, who is also a very good friend, to take this award, accept this award on behalf of Regeneron.
Thank you, Gary and NMQF. I always think about a puzzle I had when I was 5 years old. You've given real breath to the basic core of inequity in healthcare, which is really what we want to do, is to make sure that we do unto others as we would have done unto us. And I think that is one of the core tenets. On behalf of the entire Regeneron team, who has worked relentlessly over the past 18 months to discover, develop, and manufacture a brand new medicine for COVID-19, we are so honored to accept the Booker T. Washington Award. We know our science can only achieve its full potential when it's actually accessible to patients. We share your goal and so many other stakeholders, and to my partners on Zoom today, we know that we have been working 24/7 to try to cure some of the ills that unfortunately the COVID pandemic has made present. And we look forward to working with you and other stakeholders to continue in the fight against COVID. Thank you so much.
Good afternoon. My name is Gretchen Wortman, and I'm Vice President for Policy and Program of the National Minority Quality Forum. And I'm honored today to introduce Dr. Michelle McMurry-Heath as the National Minority Quality Forum's 2021 Booker T. Washington Awardee. Dr. McMurry-Heath assumed the leadership of the Biotechnology Innovation Organization as President and CEO on June 1st, 2020. Prior to assuming her role at BIO, Dr. McMurry-Heath held several senior leadership positions with Johnson & Johnson. Dr. McMurry-Heath was the first African-American to graduate from Duke's MD, PhD medical scientist training program. However, in addition to these and other extraordinary professional and academic accomplishments, what is key in our view is that from the moment she entered our consciousness in her leadership role at BIO, Dr. McMurry-Heath articulated an imperative of integrating the concepts of social justice with the business models of the biotechnology industry, not only in the components of innovation, but perhaps most importantly in assuring that all Americans have real and sustained access to those products. Therefore, in recognition of her vision, of her commitment, of her courage, please join me in welcoming Dr. Michelle McMurry-Heath. Dr. McMurry-Heath.
Thank you so much, Gretchen. It's an honor to receive this award. In fact, it is humbling. Booker T. Washington is, of course, an enormously influential figure in our history, shaping for generations how we advance the welfare of Black Americans. And for a full generation now, the National Minority Quality Forum has helped shape our dialogue as well. And as we know, it's a debate that continues today. On one hand, the poverty rates for Blacks has declined more than 50% since the 1960s. On the other hand, the education and wealth gaps between Black and white Americans remains horrifically wide. In 2019, the net worth of the average white family was 7 times greater than the average for Black families. And when it comes to health, the situation is similarly tragic. For most minorities, life expectancies are lower, maternal mortality rates are higher, and common disease research is rarer. And we all know that COVID-19 exacerbated the nation's health and socioeconomic inequalities. Lives were lost and families grieved as a result. Like many of you, my career path has been influenced by my experiences growing up. My father spent his career designing mental health programs for people who couldn't afford care, and my mother ran public health nursing in Alameda County, California. During my teenage years, I was blessed to be able to listen to or talk with low-income women about avoiding HIV infection and reducing infant mortality. Later in life, I had a decision to make, whether to become a doctor or a researcher, and it was a difficult choice. I believed that as a researcher, I could make advancements that would improve lives at scale, yet I really felt a responsibility to my home community and my church to become a doctor. And I thought I could make a direct impact on lives in my community by doing so. In the end, I split the difference and pursued an MD PhD to serve the community while pursuing what I believed was my more selfish passion at the time, to pursue science. And it helped me realize, though, how many families in our society are left behind by science, not just by healthcare, but by science. I firmly believe that science can make a difference for these families, if science makes a difference for us all. And that's why I've committed my career to overcoming gaps in our collective biomedical research portfolio, trying to ensure that we see new cutting-edge therapies who are our biggest scourges in the Black community, and that those breakthroughs reach patients of color as rapidly as possible. I call it just science, where the science being developed, the benefits it will bring, and the opportunities it creates reaches deeper into communities in ways that are just, impactful, and inclusive. I have said, and I will continue to beat the drum, that I think science is the social justice issue of our age. For too long, we have been distracted by the urgent and critical fight for equal access to healthcare. And don't get me wrong, this fight is essential. It's essential, but not sufficient. Unlocking doors to a medicine cabinet that is empty of the solutions we most need, like cures for diabetes, heart disease, sickle cell, is not going far enough. We need to fight for the science as well. But fighting back against racism in any form requires investing in better outcomes. And that's why at the Biotechnology Innovation Organization, we've launched our bioequality agenda. Our agenda has 3 aims: promote health equity in access to medicines and ensure diversity in clinical trials. 2, to invest in our Black scientists and entrepreneurs to diversify our businesses across the board. And 3, to expand opportunities for women, Blacks, and other minority groups that operate businesses that supply our companies. The inequities and structural racism in our healthcare and socioeconomic systems are deeply frustrating to me. I've seen them firsthand, working in emergency rooms, but also in boardrooms. And we won't solve these issues unless we dedicate real attention to them, make real investments in them, and maybe most of all, work together to solve them. Those have been the goals of the National Minority Equality Forum, and I'm sure will continue to be under the fearless leadership of Dr. Puckrein, which is why it is such a great honor to receive the Booker T. Washington Award and to share this virtual stage with the other amazing recipients. We have a long road in front of us, but I believe we can bend that arc of history that leads towards progress. As Booker T. Washington said, success always leaves footprints. By working together and demanding more loudly, we can improve the welfare of minorities and leave more footprints for all of those searching for a healthier and a happier life. So thank you.
Wow. Thanks so much for ending like that, Dr. McMurry-Heath. We really appreciate it. And I just want to thank the 3 winners for that, I guess, healthy dose of Black girl magic that we received for this lunch. Dr. Nicolette Louissaint from Healthcare Ready, our attorney, Maya Bermingham from Regeneron Pharmaceuticals, and finally, our double doctor, McMurry-Heath from Bio. We really appreciate you. We honor you. We love and trust the work that you do. And because of you, we know that we will continue into the next millennia. We have a bit of a break now. So thank you for attending our Booker T. Washington Awards luncheon, and be ready for some more information and some more thoughts right after this.